Welcome back, everyone. Dr. Mwafa Turjman is with us today. He's a urologist with Lima Memorial, talking a little bit about Prostate Cancer Awareness Month that's going on. We know that more and more people are getting it, and it's one of those things that is preventable and it is treatable. What are some of the things people should look for when they get of a certain age?
So, first of all, thank you for having me, Jeff. Prostate cancer is the second most common cancer in men, just after skin cancer. Prostate cancer affects 200,000 people in the United States every year, and about 33,000 deaths from prostate cancer happens every year. So symptoms with prostate cancer range depending on the stage of the cancer. It could be just frequency, when the patient goes more than usual to the bathroom to avoid, difficulty urinating, meaning he has to push and strain to get the urine out, and pain with urination, we call this dysuria. Waking up at night to go to the bathroom, we call this nocturia. All this goes under what we call the lower urinary tract symptoms. And of course, blood in the urine or blood with the semen, this is never normal. So blood in the urine, blood in the semen, I cannot emphasize enough how much this is important to seek health and help. And of course, pain in the back, numbness in the leg or in the foot. Those are all symptoms could come with the prostate cancer.
So let's say we have some of these symptoms. What's the best thing to do then as far as determining if it's cancer? I assume get a hold of you guys, and then there's a series of testing that can be done.
That's absolutely right. Testing and diagnosing prostate cancer start with the blood work called the PSA, prostatic specific antigen. Also the examination, we call this the digital rectal exam. Those are the two screening tools we use for screening for prostate cancer. Once we have any abnormality in any of those, we move to the next step, which is prostate biopsy. Prostate biopsy is basically taking samples, tissue from the prostate, test those under the microscope to see if this is just a benign tissue or a cancer tissue.
I think most people then they think about that next step, the treatment part of it, and they get scared about that because they don't know what to expect. But it seems like technology has made things less invasive and a little easier to get through as the years have gone on, hasn't it?
It is. So technology helped us in two ways. One, early detection of the prostate cancer, meaning if we detect the cancer early enough, sometimes we have the option to do nothing, just watch the patient. That goes under what we call the active surveillance, which involves no treatment, just repeating screening and biopsy every 1 to 3 years. And again, if the cancer is more advanced, we move to the next step, which is treatment. And when it comes to treatment, we have more than one option. We have the radiation therapy, we have the hormonal therapy, chemotherapy, and immunotherapy. And of course, we have the surgery, which involves removing the whole prostate. And with the surgery, we have the option to do it robotically, which involves small incisions, taking the prostate, fast recovery, less side effects and complications.
All right, excellent. And the best thing for folks to do, call 998-8276. They can make an appointment with you guys, get screened, and find out what's going on, especially if they have any of these symptoms. Dr. Turjman, we always appreciate when you're on because you explain this so well. You simplify it for us, and we love to hear that. Thank you so much for coming on.
Thank you for having me, Jeff. You have a good day.
You too. Nice having you. We'll be back after this.